All right, guys, welcome to episode 65 of the unofficial NCLEX podcast. My name is Katie Kleber, and I'm your host, and today's episode is entitled Assess Need for Patient Home Modification. This is the only episode in the home safety section of this aspect of the NCLEX. So, it's not only important to take safe care of a patient while in the hospital, but when we discharge them, we got to make sure we know where they're going, they're going to be safe. So let's talk about some specific examples. We want to make sure they have appropriate, kitchen safety, handrails, lighting, appropriate adaptive devices if they need it. And to be able to understand what they need, we have to kind of apply the patient pathophysiology to their interventions. So let's think about their deficits and their needs before we go thinking about all the stuff that they need, essentially. Kind of like, okay, let's do our assessment first before we work on a plan. So are they hard of hearing? Do they have visual deficits? Do they need something like a life alert? And do they have the dexterity to use that? Do they have like a cardiac condition or an issue where they may suddenly need someone right now and they won't have the ability to maybe, pick up the phone and call? Maybe they are an AFib and have congestive heart failure and we're worried about them having a stroke. And if you have a stroke, it's going to be kind of hard to, call somebody. Do they have respiratory issues and they need respiratory equipment? Do they have the functional ability to call someone if there's an issue? And do they have the ability to call 911 if there's an emergency? Let's talk about some just general issues, though, that people think about and maybe not think about. One of them is the hot water heater setting. That's kind of one that people don't necessarily think about, but if it's set too high, then it can make the water too hot and cause burns, which is a big issue with the elderly and infants and children. So we got to make sure that's set appropriately. Let's see. Appropriate lighting on the interior and exterior of the home. Especially important if someone has visual deficits or maybe they live in an ill-lit area. We got to make sure that if they come home later in the evening, that they can see their front door. They can see their steps, that the light switches are in an appropriate location so it's not like they've got to walk all the way through a dark room to turn on the light switch, if that makes sense. Other things, trip hazards like rugs or cords that are, across walking spaces. Also, cleanliness is an issue. If the patient lives in an unclean, maybe like a hoarding sort of a situation where we have mold, we have fecal matter of animals, we have issues with air quality, those can be health issues. So we got to make sure they're living in a clean environment. We want to assess if they have stairs, especially if it's someone that's a fall risk. Is their bedroom upstairs and everything else downstairs? That's very different if a patient has stairs, but the only thing that's upstairs are guest bedrooms, something like that, and their master is on the main level. And maybe they don't routinely go upstairs and don't need to go upstairs to normal everyday function. Versus maybe they don't have any stair. Maybe it's a ranch style home, but there's maybe like a half a set of stairs to actually get into the home. Gotta know those kinds of things. Also important to know about pets. Do they have a dog or a cat or some other animal that they have to care for? Are they able to care for the pet? Are they able to dispose of the fecal matter and excrement appropriately? And do they realize how often they need to do that? Are they already doing that appropriately? And is this animal a trip or risk for falls? Like, will they maybe, something my dogs do, and I have bigger dogs, but I'm inevitably making dinner, and the dog just sits literally right behind me when I am trying to cook dinner. And I can't tell you how many times I've fallen. We actually used to have a rug in our kitchen, and I liked it in there because it kind of, we have tile and it kind of warmed it up a little, and it was just like a kitchen rug. And then I noticed the dog kept laying on it when I'm trying to make dinner, and I'd keep almost falling. So I moved it out of there, and the dog ended up sitting on that rug no matter where it was, so I wasn't falling. But you got to think about that kind of stuff. Also important to think about medication labeling. Do they know what meds? Can they tell the difference between their meds? Can they read the medication label? Or do they just know, I take the white pill at this time, the blue pill at this time? We want to understand, maybe they have one of those med weekly things where Sunday, Monday, Tuesday, Wednesday, are they filling it up appropriately? Or is someone else doing that? And also their ability to lift things, like thinking about maybe a pot of hot water. Maybe they're making some pasta or some, mac and cheese. Will they be able to lift that pot of water, or are they at risk for dropping it? Also, use for patient protective equipment when using devices that can cause injury. So maybe are they giving themselves shots of insulin or various medical equipment like, oxygen? And are they smoking around oxygen? Or maybe they're using their oxygen tank and they light a fire because it's cold and they want a fire in the fireplace. Are they able to utilize oven mitts for kitchen safety? Do they know how to use their respiratory equipment appropriately? A couple things to help with the evaluation of the environment is completing a walkthrough, noting concerns like we talked before about, making sure their exits are clear and clearly marked. It's not like they have to move things out of the way or go around things to quickly get out of the home. Could they make a quick exit if they needed to? Are things blocking the door, or are there things in front of the door like piles of newspaper or piles of things that could fall over and prevent safe exit? Does the patient have a fire extinguisher? Do they know who to call if an emergency occurs? And if they have oxygen at home, do they understand the fire hazard concern? Do they understand the RACE and PASS acronyms? So that's just and that's kind of a bigger episode and a lot to think about. We need to make sure, there's an aspect of this that's applicable for a home health nurse and someone who's actually walking through the home, an aspect of this that's applicable for the bedside nurse who's discharging somebody home. But, home, we like to want people to go home, but we need to make sure home is safe. Home is not always safe. In a very practical setting. I'm not talking about people in abuse situations, but I'm talking about just practical home safety as that is concerned with devices and items and practical environment, not the relationships or people around. So these are things to keep in mind, various things to assess and consider when we're assessing the need for patient home modifications as it relates to home safety.
This has been another episode of the unofficial NCLEX Prep Podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at nrsng.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.